Thank you, Chair Moore, and to all the testifiers, let me add my thanks to Chair Moore for your thoughtful and careful testimony, sharing your views. Let me first start with an update on COVID. I think, as you know, Hawaii had managed through the first year of COVID really as well as any state in the country. And last spring, things were looking really quite good for fall. Then the Delta variant hit beginning in the summer, and our faculty and students once again pivoted in the face of what turned out to be actually the highest increases in cases and deaths due to Delta of any state in the country. And the magnitude of our increases was so significant because we had been so successful prior to Delta. But those increases were very real. Our healthcare systems were at high risk of severely consequential overload. And the good news is that, and I think you know I attend the governor's cabinet meetings, it's pretty clear we're now back into recovery. What was reported yesterday is that across all of the key indicators like case counts, test positivity rates, and hospitalizations due to COVID, those indicators are dropping by about half every 2 weeks. And we've seen 2 cycles of that and hopefully are continuing on that path. With booster vaccinations on the way to approval for all the approved vaccines, probably within the next week or so, and emergency use authorization pending for vaccination of 5 to 11-year-olds, we really are on the way to significant improvements in community resistance to COVID. So even as we continue to ensure a safe fall, we are by no means out of danger. And our case counts within UH are actually lower now than they were last year. We are now quite focused on returning to more fully in-person experiences in the spring. That includes both significant return to on-campus instruction and also on-campus services. Our safety measures will remain strong, including requiring vaccination of all students before they can register for any in-person spring class, and continuing to work with our unions on the implementation of the vaccine requirement for employees, which is increasingly required as we see new federal mandates, given the significance of UH as a contractor to the federal government. We will continue to require masking indoors and keep all of our other safety protocols in place. Online classes and services are not going away. One of the testifiers referred to silver linings, and I think that's a silver lining to the pandemic. But we absolutely need to restore more in-person classes and services. We see it, we hear it from our students, we hear it from their parents, and in some cases we can see it in our data. And we need our faculty and staff back on campus to create effective learning environments for all of our students, including some of those who are not coming to college, who are not well suited to the fully online experiences. Our campuses have been as safe as anywhere in the state throughout this pandemic. We plan to keep them so, and I'm very grateful to all of our staff, administrators, and faculty who have made that a reality. But now we need to reclaim our campuses for our students, faculty, and staff, and that is our priority now over these next months. Key to this will be increasing the numbers of our students, faculty, and staff who have uploaded their vaccination records to our Lumicite UH system, which also tracks daily health checks, are you feeling okay, and COVID test results for those with approved exemptions. Let me shift now to enrollment and say just a bit. We have passed our formal census. The numbers have come out, much as I had foreshadowed in some of our previous meetings, and we got extensive media coverage, which is always nice when it's good news. As promised, we'll provide a more thorough report to the board next month when we've completed a more detailed analysis across the multiple enrollment characteristic and dimensions that we track. So just a few quick highlights for today. Headcount enrollment for the UH system increased for the first time in a decade, with fall 2021 headcount enrollment for credit of over 49,000 students. It's a 0.4% increase, and it bucks the national trend of downward enrollment really since 2010. 4 of our UH campuses had enrollment increases: UH Manoa, UH Hilo, and Leeward and Windward community colleges. UH Manoa saw its largest enrollment increase since 2003, 6%, which is remarkable. As our largest campus, that increase is really what fueled the system-wide increase. Manoa is back up over 19,000 for the first time since 2014. Peak for Manoa has been in the 20,000 or so range, a little over 20,000. But what's really positive is that increase is up across nearly every category, including resident, continental U.S., transfer, and international students. Retention held steady, and Manoa welcomed its largest first-time freshman class in history. UH Hilo enrollment was up for the first time since 2012 with a 2.5% increase. The 459 first-time freshmen represents the second largest entering class since 2003. They just missed last year's record of 462 by 3 students. We'll look forward to next fall being even higher. But UH Hilo enrollment was also bolstered by a significant increase in transfer students, a 20.8% increase in transfers, and students who returned to finish their degrees after leaving school because of the pandemic. While West Oahu saw a decrease of around 5%, it's just 160 students fewer than its record high last year, and it's also the 5th straight year UH West Oahu headcount credit enrollment has topped 3,000. That seems to be where they've stabilized for now. Overall enrollment at UH's 7 community colleges is down 3.2%. We don't like to see that, but do need to note that's significantly less than the national downward trend for community colleges of over 9%. And as I've noted before, the community colleges are fulfilling much more of their mission these days with non-credit instruction, short-term training, much of which is funded through extramural and philanthropic funds. Let me update you now on a significant development for JABSOM, and this has been a project underway for several years, led by JABSOM Dean Jairus Hedges. And we reported on this in the media, but I wanted to share its significance here with you as well. UH has now completed comprehensive academic affiliation agreements with the 2 primary healthcare system partners, Queens and Hawaii Pacific Health. These agreements, new agreements, really define the relationships through which UH makes use of their key healthcare system facilities as the clinical learning environment for UH John A. Burns School of Medicine and also for other UH health system health science programs. This is critical because UH is a community medical school without our own hospital, unlike many of the very large medical schools on the continent. The agreements also transition our faculty healthcare providers from University Health Partners, UHP, and some of you will remember that organization as USERA. Regent Akoba sits on the board of that as your representative. And that's our UH practice plan, and we have now transitioned our faculty who teach and provide clinical practice into the medical groups of our partner healthcare systems where they practice. So it's a pretty significant step forward for us. These health system-based integrated academic practices will provide academic support for our faculty positions and joint academic programs with the partner health systems, as well as enhance the role of JABSOM in health system strategies and planning. So if regents are interested in the details, Dean Jarvis Hedges would be pleased to provide a more complete report, perhaps to the Academic and Student Affairs Committee or the Personal Affairs and Board Governance. This is one of those, the many things that we do that crosses over the purviews of multiple Board of Regents committees. Next, and I think pretty relevant to the testimony received this morning, let me comment on the Senate Concurrent Resolution 201 Task Force, as tenure is a primary topic today. Last legislative session, a joint resolution that was proposed by the Senate, Senate Concurrent Resolution, or SCR 201, passed both chambers of the Hawaii State Legislature. This resolution is distinct, but in some ways overlaps the charge and work of the Tenure Permitted Interaction Group. It calls for a joint UH-UPA task force chaired by the Board of Regents chair, and it prescribes the membership and the contents of a report that is requested. Now, as a matter of standard practice, UH does try to follow joint resolutions that are passed by both chambers. They do not have the force of law like a statute, but they do express the will of the entire legislature. Just as a point of information, if a resolution passes only one chamber, we tend to follow it if we believe it's appropriate and helpful to UH. So the SCR 201 task force was created by UH and UPA. My thanks to Christian Fern, who worked with me on that, and to Chair Moore, who has now chaired 2 meetings of that group as called for in the reso. Based on our first 2 discussions, we've outlined the substantial data collection requested in the reso and begun the work to collect that data. The task force has also discussed the importance of consultation with faculty groups prior to finalizing our report, and we've committed to engagement both through the All-Campus Council of Faculty Senate Chairs, whose members can also engage their senates as appropriate. Since I now lead the Manoa campus, the Manoa Faculty Senate chair reached out to me directly, and I also committed to share our work directly with them. So the heart of the report requested in this reso is the last section, which requests proposed amendments to UH's existing tenure system and compensation structure for researchers and other non-instructional faculty, incorporating the best practices implemented at the majority of peer higher education institutions across the United States, while meeting the unique needs and circumstances of this state. So it's fairly broad. As you can tell, the input provided this morning will certainly be useful. The task force has not discussed any specific ideas for amendments yet, preferring to be informed by the data. I believe that before the Tenure PIG report was issued, I thought it would provide very useful input into the work of this task force, and I still believe that will be extraordinarily helpful. In addition to the ACCFSC, I've worked with the Manoa Faculty Senate Chair, as I mentioned. I've talked with the full Manoa Senate Executive Committee about this topic, which is of pretty significant concern, as you all heard this morning. Yesterday, I was grateful to be invited to join the Manoa Faculty Congress, which includes the entire UH Manoa faculty, for a discussion of these matters. And tomorrow morning, I will be meeting with the All-Campus Council of Faculty Senate Chairs. Previously, I've only had direct discussion about this with their 2 co-chairs. And I'm really, as I mentioned, grateful to our dedicated faculty leadership for creating these opportunities for dialogue with me. Chair Moore's recommendation on the PIG report to the full board has been public for a week now, and I know you will be deliberating carefully and thoughtfully later in this meeting on that, on the PIG recommendation, Chair Moore's recommendation, and other ideas that may arise. And this is your very first time for discussion and consideration, and you'll be taking that up in public. I will just say, not knowing what you will decide, that if Chair Moore's recommendation is adopted by the board, I would expect the next steps to include the SCR 201 task force completing its work, including the consultation with faculty representatives that I've mentioned. The Board of Regents Committee on Personal Affairs and Board Governance could then take up both the task force report and the PIG report together next year and make a recommendation from that committee to the full board. And I note that the work of the PA and BG committee would, of course, be conducted fully in public, including accepting testimony at every meeting of the committee. I will say, I believe it is not something that would be completed in one of our regular meetings, so the committee might have to do more work than expected in the spring. Let me shift now to a couple other areas of legislative engagement. Since my last president report, where I shared a number of informational briefings and inquiries and responses we provided, we have had no more formal hearings, but both UH and RCUH have received additional inquiries from the Senate Higher Education Committee. UH has been asked about the construction of our beautiful new life sciences building. Vice President Gouveia has provided information on that project, which we have now submitted back to the Higher Education Chair. RCUH has been asked about a federally funded Title III renovation at UH West Oahu to support Native Hawaiian and other students. That project was administered through RCUH, as are nearly all of our federally funded construction projects. Since that project was carried out jointly, UH West Oahu is providing information to RCUH, which will then respond to the Senate Higher Education Committee Chair. Two other activities relating to legislative interest. SCR 183 requested the University of Hawaii to convene a task force to examine and assess its arrangements for services with RCUH and whether changes to the terms and conditions of the UH-RCUH internal agreement would be warranted. As it happens, UH had already convened our own working group before session began to review the internal agreement, the associated management fee, operational costs, and provide recommendations to both UH and RCUH. So this Senate concurrent resolution really just continued the efforts of the existing group. The task force was chaired by Vice President Sirmos from RCUH. We had Executive Director Lenny Gouveia and Director of Finance Glenn Yee. The Board of Regents Chair's appointee was Regent Jean Ball, who also serves on the RCUH board as a regent. And the three appointees from the UH president were Brian Taylor, Dean of SOEST, our largest extramural funded unit, Mike Unabasami from the UH Community Colleges, and Velma Kameoka, the Vice Provost for Research and Scholarship at UH Manoa. In summary, the working group found that the primary driver of the operational cost was the implementation of the RCUH strategic plan that was created in response to a 2015 legislative audit. Three major sources for the increase were identified. An increase in depreciation, which resulted from planned equipment purchases to support IT modernization and improvements, and increases in IT service costs, which were necessary to implement the planned modernization and improvements to RCUH's finance, procurement, and HR systems. And lastly, increase in RCUH project development, a joint initiative between RCUH and the UHVP for Research and Innovation, which was discontinued in 2021. UH members of the task force believe that while RCUH provides an essential service, the extramural awards management fee needs to not go above 10% of the available RTRF allocation. That's currently about a little over $50 million, so that would keep the management fee at in the range of $5 million. So the task force is recommending that UH and RCUH explore ways of reducing the management fee. Ideas floated so far have been reducing the volume of non-extramural grants and contract service orders to RCUH by changing the service order criteria and considering ways to reduce RCUH's future IT costs, including through greater collaboration with UH. Sorry, Vice President Yoshimi. Terms of the UH-RCUH internal agreement might then change based on the examination of these recommendations from the task force. As a result, the task force and the legislative report did not recommend specific changes yet to the current UH-RCUH internal agreement. The full report will be submitted to the legislature as called for in the joint or the concurrent resolution. We wanted to share this with the board today since the R&I committee does not meet again until next year, but Vice President Sirmos would be happy to report and provide more information if the committee so desires. The second project I want to mention relates to the UH Cancer Center Early Phase Clinical Research Center. And this arose at the request of Regent Higaki at a prior board meeting. And as a result of his question, I asked again Vice President Sirmos to assemble a task force to provide an assessment of the business plan, and in particular, the challenges and opportunities facing the Cancer Center's Early Phase Clinical Research Center. The program will be operating in the new $13 million facility being developed in the shell space in Kaka'ako. The task force was led by Dr. Larry Shapiro, the CEO of University Health Partners. Our practice plan, formerly dean of one of the largest medical schools in the country at Washington University in St. Louis. We also are grateful for the help from the chief medical officers of our major healthcare systems, Rick Bruno, the VP for Patient Care at Queens, and Les Chun, CEO of the Hawaii Pacific Health Medical Group. Also participating was Amy Grace, who many of you know, the director of our UH Office of Strategic Health Initiatives, and herself an MD. And of course, participating were Joe Ramos, Deputy Director and currently Interim Director of the Cancer Center, and Cliff Martin, the Associate Director for Administration at the Cancer Center. The task force identified both challenges and opportunities that they see in the operation under the current business plan. The challenges or concerns include whether we'll have enough, the patient enrollment targets for participation are high enough, whether the philanthropic support will come through at the levels predicted, the operations and logistics requirement to really run more like a clinic, a small clinic or outpatient treatment center, rather than as a research program. They noted that the early phase clinical trials program may not be able to conduct clinical trials requiring radiation therapy, cell-based therapies, and advanced imaging technologies, since those are capabilities not currently available at the UH Cancer Center. And they noted competition from the local healthcare systems, which have ties to large cancer centers on the continent, including MD Anderson, Cancer Care Alliance, and others. The opportunities they noted include expansion of scope to include not just phase 1 and phase 0 trials, but phase 2, phase 3, and even non-cancer clinical trials. That could be a way to increase patient numbers and revenue. They suggested consideration of augmentation to a long-term survivor cohort to provide value-added services to patients. They suggested UH consider establishment of an academic division of oncology at JABSOM that could help build needed expertise in specialized areas of cancer care and science to benefit the state and the Pacific. And finally, creation of new enterprises and other future growth with the private sector as we build the UH Cancer Center's reputation as a center of excellence, not just for research, but also for cancer care. So the challenges identified are significant. There's no question about that, and the opportunities are also substantial. The task force does believe that the future is bright for the early phase clinical trials program, and UH Cancer Center leadership does appreciate the insight from these seasoned industry professionals, which that input will enhance the program plans moving forward. And again, that's a brief summary. Vice President Sirmos can provide more information at the next R&I committee meeting if desired. And my thanks to Vice President Sirmos for his role in taking both of these on. The last area of legislative interest I want to mention is, and I know former Regent Sullivan is with us today and has been listening to the testimony. Some of you will recall that at a board meeting earlier in the year, she suggested that UH should step up to lead broadband initiatives for the state of Hawaii. Interestingly, literally later that day, the governor reached out to me to ask me for help with broadband. Then I got a call from House Finance Chair Luke to meet with her and staff from Senator Schatz's office. Senator Schatz is well positioned on multiple committees to influence the future of broadband in Hawaii and the nation. Then we met with cabinet agencies, and where we stand today is that the governor has identified UH as the lead agency for multiple broadband initiatives across the state, working with all of his executive agency and their leadership. We're now starting on biweekly meetings with the governor. We have also had a couple of meetings assembled by Chair Luke with both House and Senate representations, with Senator Schatz's staff as well. He himself attended only the first of these meetings, and they have also requested leadership from UH to help move these things forward. So once again, thank you, Vice President Yoshimi, for your partnership on this with me. Let me close with this last section of a couple of quick items. First, on extramural funding, I will just note that as of this morning, our extramural funding for the fiscal year is just over $226 million. That's an increase of over $3 million from where we were on the same day last year. We hope to continue this upward trend. If we continue at this pace, we are on track for the best year of extramural funding in the history of the University of Hawaii. Credit to many, many people across our systems, particularly our faculty at UH Manoa, but really everywhere for driving this. And I just want to mention, as last month, we had another very successful month with over $20 million in funding from federal programs that support underrepresented populations. In particular for us, we got support for programs to increase the success of Native Hawaiian and other students across all 10 of our campuses, as well as programs to support the Pacific Islands in areas of climate and Pacific Islander students as well. Details are provided, and I think many of you get the press releases, but I did want to highlight that. You can always check our UH News platform and the www.hawaii.edu/news website. Lastly, one of the highlights of this last month, I think for me personally, but also for the campus, is a wonderful event we hosted right after the last Board of Regents meeting. South Korea President Moon Jae-in paid tribute to 2 Hawaii women who immigrated from Korea and were formally recognized as revered. The term is women patriots at a ceremony on the steps of UH Manoa Center for Korean Studies. These awards were presented posthumously to Chung Song Lee An and Nodi Kim Hai Kim Son, recognizing their groundbreaking efforts in the Korean independence movement after they moved to Hawaii in the early 1900s. Their relatives attended the ceremony and received the awards in person from President Moon. We're really honored that he chose UH Manoa as the site of this ceremony. I can't say enough about the incredible work of Taeyong Bak, director of the Center for Korean Studies. He's a professor of law here at UH Manoa, for making this challenging event a reality. And in the mix was UH's dear friend, Duki Lee Murabayashi, who I think many of you know. So with that, let me turn it over to Chancellor Daisy. Kauai Community College is our virtual host for today's meeting.
Excuse me, actually, President Eisner, before we go to Kauai Community College, Regents, any questions, comments, or discussion on anything in the President's report? Regent Kudo.
Yeah, in regard to the Cancer Center study, I'm glad that we've done that. I think it has been something that's been needed. I would like to see that copies of that report be given to the regents, and that whoever is appropriate that was participated or headed up the report be able to give a short presentation of it and answer any questions in one of the substantive subcommittees, be it R&I or internal audit or whatever, that opportunity be given to the regents once they've had ability to digest the study or report.
They can do. Thank you, Regent Kudo.